So I'm going to act as the moderator for today's sharing from Java Medica and also presented by you. My name is Dr. Jane. I'm a dermatology faculty staff from Atma Jaya Catholic and I would like to say thank you to Java Medica and also Dr. Silverio for this nice opportunity. And while we are going to wait for other participants to join us, so we can get prepared for today's presentation. Thank you very much.
Thank you very much.
So, Pak Yasir Amron dari Java Media. Ya, jadi kita mulai kurang lebih jam berapa ya? Ya. Kurang. Kenapa? Mestinya ini ada Dokter Isadora. Dokter Isadora adalah sekretaris atau wakil ketua PSPD atau program studi profesi kedokteran. Jadi yang untuk terutama untuk pendidikan kepaniteraan kliniknya. Lalu sudah ada bersama-sama dengan kita ada Dokter Sheila. Mr. Silverio, where are you live from? Are you?
We are in Portugal. We are in Portugal. I don't know if you are where it is. If you know where it is.
I know. It's somewhere in Europe. How is it? Everything there? And may I know what is it?
It's more or less. The numbers of the COVID are increasing. So we don't know if we will have a new lockdown. In the meantime, it's very cold because we are now in the winter and it is around 2 degrees Celsius. And, and how is the weather in your country?
Oh, my country is always very sunny throughout the year. We only have like one season, summer. Even though it is a rainy season, we still have like sunshine all over the year.
I'm having lots of envy.
Yes, and I hope that everything is fine there. And what is the time zone there? So we are in Indonesia. We are 4 p.m. right now.
Yes, and right now here it's 9 a.m.
Okay, so good morning.
Good afternoon. You are just finishing your day and I'm just starting out my day.
Okay, so I think we will, can we just have some more time to wait for...
Yes, feel free. We have time. So please feel free.
Boleh. Nah, untuk acara ini saya berlaku sebagai memandu untuk PIC-nya Dr. Nelson ya. Apakah Pak Yasir sudah menghubungi belum ya? Sudah, terus dari beliau bagaimana? Oke. Uh, Oke. Begini, Pak Yasir, sementara nih saya juga sekalian mau pindah aplikasi ke apa namanya ke laptop. Ya, coba saya hubungi Dr. Nelson juga ya. Oke, thank you. Ya, selamat sore Dokter Ika. Mas, ya, Mas Yasir, ini ada Dokter Ika. Kebetulan beliau juga adalah ini wakil dekan satu. Um, jadi untuk acara ini sendiri dari IC-nya ada Dr. Nelson, namun beliau berhalangan untuk hadir pada sore hari ini. Namun sudah ditanyakan mengenai apa namanya tadi ditanyakan latar belakangnya sebenarnya karena kita tahu bahwa masa pandemi ini memang kita sangat sulit sekali untuk apa ya untuk bidang pendidikan, terutama untuk di kepanitiaan klinis, di mana kita harus berhadapan langsung dengan pasien. Mungkin body track ini bisa menjadi salah satu alternatif untuk mencapai kompetensi bagi para mahasiswa yang saat ini. Jadi ya, mungkin ada tambahan dari Dokter Rika atau Dokter Isabella Gracia.
Selamat siang semua. Saya sudah mencoba untuk memanggil lagi di grup info FKIK. Semoga yang join bertambah banyak. Karena saya juga miss tadi kalau nggak dipanggil sama Dokter Isadora. Lupa karena habis nguji, terus langsung beberes lupa. Dilipet laptopnya.
Jadi kebetulan memang banyak kegiatan juga ya dok hari ini di fakultas di FK, ada yang menguji, lalu juga mungkin ya ada juga yang sudah mulai berpraktek. Jadi jam-jam segini juga memang kan jam-jam ini ya, jam-jam.
Iya, salam kenal nih Pak Yasir dari Java Medica. Kenalkan saya Rika. Terima kasih buat Dr. Ineke Jane yang mau membantu saya pada sore hari ini dan mengingatkan bahwa ada acara ini. Oke, baru pada join. Silakan ditunggu ya Pak Yasir dan Dr. Jane.
Baik dok. Jadi sudah ada beberapa yang sudah mulai masuk. Ini ada Dokter Marcella, beliau dari Departemen Ilmu Penyakit Dalam. Lalu ada Dokter Robi, koordinator Fakultas, Dokter Ervan juga di bidang etika dan kesehatan serta ini ya, terutama yang berhubungan dengan legal. Lalu ada Ibu Evi, ada Dr. Ervan, spesialis THT, kepala leher dan staf pengajar juga di FK. Lalu ada Dr. Loreta, spesialis perut dan kelamin. Ada Dr. Nawanto Agung, beliau spesialis kesehatan dan olahraga juga. Lalu ada Dr. Komang di sini, Dr. Giselle. Ya. Selamat sore semuanya. Kebetulan narasumber sore hari ini Silverio Mendes dari Portugal. Beliau sudah bersama-sama dengan kita, tadi juga sudah menyapa. Mungkin nanti kalau misalnya kita bisa berikan ini ya dok, Dokter Rika, mungkin kita bisa berikan tenggat waktu hingga pukul 16.20 mungkin kita bisa mulai ya dok, supaya narasumber juga tidak menunggu terlalu lama. Dan ada Dr. Andi hadir di sini, beliau adalah spesialis anak. Mungkin sebelumnya izinkan saya membuka acara ini. Good morning, Mr. Silverio Mendes. We have some participants has already joining in with us now. There are several specialists from several fields, including pediatricians and then dermatologists, and internal medicine, and we also have ENT here, and some doctors and the faculty staff here are also in structural, such as we have our vice dean here, Dr. Rika.
So it is a pleasure to meet you, all of you. Thank you very much for this opportunity to introduce the Body Interact. Thank you very much also for Yasir from Java Medica for bringing us to your institution to be able to present the Body Interact. The Body Interact is a virtual simulator that helps in this specific moment, for example, due to COVID-19 shutdown that many times we have the lockdowns in our countries, and with the Body Interact we can keep doing the practical classes online, and we can use it in different ways. I will make a short introduction about the Body Interact, about also some research studies that we have been making all over the world, and after I will explore a clinical case together with you, explaining just only about how it works, how the buttons works and so on. And after I will invite you to solve different clinical scenarios, for example, from the EMT, from the pediatrician, from the internal medicine and so on. All the targets that are also here. In the meantime, Java Medica will be also very glad if they can share with you some trial license that you can explore 2 weeks, during 2 weeks, with a couple of clinical scenarios that you can explore by your own. In this way, you can touch the system, you can install the system, and you can answer to the questions that you have, or if you would like, we can schedule another online meeting in order to clarify any doubt that you probably will have. So I will ask your permission to start here sharing the screen with a couple of slides just to make a short introduction. The Body Interact is considered that is the learning accelerator for medical and nursing education. The Body Interact, it's available in the tables that we can all the people around the table if as it is a real patient, the emergency room, for example. You can also install the Body Interact in your mobile phone, in your tablet, in your Windows computer, and so on. We have the possibility to share the screen if you would like to, or we can also have the possibility to give to the student, and the student can play it at their own home. For example, if they will install in your smartphone, if they will install in your Windows computer, and so on. So they can make the case when they are at home. Here are some recognitions that we have already been receiving. For example, the European Seal of Excellence. We also recently won the World Summit Awards. It is a program from the United Nations regarding the learning projects that are helpful to empower the healthcare professionals. We also have here, some reference institutions that also work with us, like the European Society of Cardiology, the American Heart Association, the Pan American Trauma Society, and so on. So this also works with the Body Interact, and they also certify the competencies of their members using also the Body Interact. We work in two main levels. We work in the pre-graduate education, in the medicine and nursing, and also in the professional development, making live events and also e-learning projects. In the professional development, we work more close with the medical societies, designing specific projects with them. The targets that we serve are the medical schools, the nursing schools, the teaching hospitals, the first responders, the simulators, the high schools, the personal home supporters, and as I explained it to you before, we also work very close with the certification providers. Regarding the simulation centers, let me also underline to you a thing, that when we are talking regarding the simulation centers, we usually talk about mannequins, about desk trainers, and so on. And we usually talk about activities that needs to be made inside the simulation center. But Body Interact, it is a little bit different, because you can work inside the simulation center, or if you would like, you can also work outside the simulation center. And when I'm mentioning that you are able to work outside the simulation center, you can bring the simulation outside the simulation center, for example, to a big classroom that you can project with a big projector, and you can challenge all the students about what she should make to stabilize the patient, and in a collaborative way, you can engage with all the people. But you can make, in a distance learning environment, you can also make specific strategies to engage the students. Or you can use it like we will be using right now, that I will be sharing the screen and asking your opinions about how to stabilize the patient, if we should monitor, if we should ask an exam, if you make interventions, and so on. This is one possibility. Another one is giving to the students the possibility to perform the clinical scenarios when they are at home. And we have a built-in learning management system that helps you to understand how they have been making on the Body Interact. if they solve correctly the clinical scenarios, what were the mistakes that they made, what were the exams that they did request that does not make any sense request, what were the exams that they should request that they did not request. So this is the different ways that you can also use it. But if you would like, you can also make OSCEs to make evaluation sessions to the students. You can create your own OSCE and you can apply the OSCE in this evaluation session with the student. So the Body Interact allows you to make the practical classes in a distance learning environment, the practical classes in a face-to-face environment, but also if you would like to make the evaluation, you can also make the evaluation using the Body Interact in a face-to-face session or in a distance learning session, because you will be able also to apply different OSCEs to different patients. Inside the Body Interact, we have a huge physiological algorithm that is
Sepertinya bermasalah, Pak. Saya juga freeze tadi. Mungkin perlu keluar dulu, kemudian masuk lagi.
so sorry. I believe that I have a problem with the internet connection.
Okay.
So sorry, because I keep talking, but no comments from your side. Can you please let me know what was the point that I lost the connection?
It started to stop when you start to show the video.
The video.
The picture of Body Interact.
From the beginning?
Yes.
Let me see. You did not saw this, or you saw this?
Yes.
Did you saw this?
Yeah, this from this picture, then we started to lose you.
Okay, perfect. So I don't know if I will repeat or not. So we have inside the Body Interact, we have a physiological algorithm that I don't know if you already know or not. And we have one physiological algorithm for all the. Right now we are covering 18 therapeutic areas. And we have one physiological algorithm that have more than 60 interventions, more than 160 medical tests, more than 300 health conditions, and more than 300 medications. So it means that every decision that we will take, it will impact the patient health conditions. If we make good decisions, the patient health conditions will go better. If you make wrong decisions, the patient health conditions will deteriorate. So we have all these 18 therapeutic areas that we are now covering, and imagine that we are dealing with a patient in a cardiology field, for example, and we decide to give some respiratory treatment to the patient. As in a real life, it will be also impacting the patient health conditions. So although it is a clinical scenario based on the cardiology field, for example, every exam that you will be requesting, it will be impacting the patient health conditions of the patient. So everything is related, and it is just only one physiological algorithm for all these therapeutic areas, and it gives you also the real life taste of the real world. We already know that better than virtual patients are the real patients, but with the virtual patients in a safety environment, and in order to reduce medical errors, you can also deal with different patients. For example, from babies to teens, to pregnant women, adults and seniors. On clinical scenarios, we have also 3 difficult levels. So we have scenarios designed for the basic level, scenarios designed for the intermediate level, and scenarios designed also for the advanced level. The main difference is between the basic level and the other 2 levels, because every time that we are dealing with a patient in a basic level, it means that there are scenarios more tailored for the young students of medicine. Like, for example, they don't need to be so familiar with the dosage of the medication, because, for example, if they need to give, for example, a diuretic, for example, to this patient, once they are just only in a basic level, they will be just selecting the family of the medication, for example, diuretic. On the other hand, if they are dealing with the patient in the intermediate or advanced level, they must press the family of the medication. After, they will press the product, and they will be selecting the dosage, administration mode, and so on. This is the main difference. For example, if you want to give a diuretic in the basic level, it is be just selecting diuretic. On the other hand, if you are dealing in the intermediate level or advanced level, you must select diuretic. After, you will select, for example, furosemide. You will select intravenous, and after, you will be selecting also the dosage of the medication, for example. This is the main difference. And the body tract also gives you the real taste of the real world, because you will be also suffering and feeling the stress of the real world. Because with the body tract, you also have the real pressure, because you will be seeing the patient with the face expressions, if he's feeling pain, if he's conscious or not conscious, if he's cyanotic or not. So this is the main difference of making the simulations with the mannequins and making the simulations with the body tract, because the scenarios are pre-designed, and every time that you request an answer from the patient, you will give you with their own voice, and also the visual signs will be also available to your eyes. On the other hand, if you are making the simulations with the mannequins, you need to prepare the simulation in advance, and you can pick the exams in order to show the exams, and you need also to give you the answers with your voice according to the questions that the users are making, and applying also for the possibilities also to make the questions, visual signs, and so on. So I will come back to the slides in order to share with you here that we have the possibility to have the learning management system, the built-in learning management system that allows you to combine a hybrid live classroom with a distance learning. So you can use it when the students are at home, or you can use it when the students are in a face-to-face classrooms. Here it is our learning management system, that is the Body Interact Studio, that allows you to track everything that the students are making at home or in the school, for example, because they can also use it. Here are 3 different ways that they can also use in a face-to-face environment, not in a distance learning environment. So you can see on the left top side, you can see a student that is performing a scenario alone. On the right side, you can see a student that is performing a clinical scenario, and the teachers are also evaluating him. And down, you can also see the teacher is mediating a discussion because they are making the simulation in a classroom, and all the students are engaged in order to try to stabilize the patient in this classroom. This picture I also like very much because it's combining the real world with the virtual world. Here you can see that is a real patient. Here it is a gentleman that can touch the Body Interact system, 3 teachers that are evaluating also the students, and 2 students. Every time that the students are making a question, they will address the question to the patient, but every time that they need to give a drug, to make an intervention, to check the vital signs and so on, they will be always applying it on the Body Interact. So it is a way that you can also combine the possibility to make in a hybrid way the virtual world with the real world. We designate this concept as syntegration, that you can also bring, for example, the test trainers, the mannequins, and so on, and you can make it as you want. Let me share with you, I promise that I will be ending soon this presentation. We have been making an impact research study all over the world. Let me also share with you the main conclusions from the student's point of view. For example, after a guided experience with the Body Interact, the students recognize the experience with the simulator as an enhancer of clinical reasoning development and organization. And they also concluded that the Body Interact promoted an integrated learning process. I would like also to share with you the main conclusions from the teacher sides. The teachers concluded that the Body Interact promotes the clinical reasoning organization in the students. They concluded also that the Body Interact reinforces the learning process in a class context, that the Body Interact optimizes the discussion of clinical cases, and also that helps in development of the communication and teamwork skills. And obviously that once it is a very engaging and a very new technology, they also verify that promotes the student engagement regarding the clinical practice. So I believe that you have a couple of questions to make it to me and to Yazir right now. So we will be very happy to answer to all the questions that you probably already have in this moment. And after we will start explore a clinical case.
Thank you very much, Mr. for the presentation. Baik, untuk Java Medica mungkin ada yang ingin tambahkan dari Mas Yasir sebelum kita menerima pertanyaan dari para dokter dan staf pengajar di Zoom meeting ini. Bisa di-unmute dulu ya? Kayaknya belum di-unmute. Ya, Oke, jadi kalau tadi kita sudah lihat sedikit mengenai Body Interact ini dari para dokter sekalian dan staf pengajar, apakah ada pertanyaan yang ingin ditanyakan? Sebelum nanti kita akan masuk ke simulasi penggunaan Body Interact ini ya, Pak Yasir ya. Jadi dari ini saya bacakan pertanyaan dari Dr. Andi Setiawan. So I'm going to read a question coming from Dr. Andi. Dr. Andi is a pediatrician here. He's asking, can we add a clinical case by ourselves to Body Interact?
Thank you very much. I just only see this right now in the chat box. Yes, you also have this possibility. We already have predefined clinical scenarios in our standard library. This is your first step, that you need to select what were the cases that you would like to use, but you also give you two different options, or customize an existing clinical scenarios based on changing the priorities of the clinical scenario. For example, imagine that I put to check the airway as a first priority in this clinical scenario, and you do not agree that is a first priority, and you would like to put to check the capillary fill time, for example, as a first priority. So you can change it. And for the highest package, for the premium package and for the standard package, we can also evaluate with you the possibility to make together clinical scenarios. In our business model, we will never charge you by developing clinical scenarios, because we will be making it for free. But
sorry to interrupt. Melly, yeah.
I already thank you. So we can give you the possibility to design your own clinical scenarios. Obviously, with that, we will not give you the possibility to develop 20 clinical scenarios, but we may evaluate with you what will be the clinical scenarios that you are having this need, comparing it in our standard library. If you would like to have specific clinical scenarios, for example, and we can develop together specific clinical scenarios. We have the authoring tool that allows you to design these specific clinical scenarios, but it is not in our business model give you unlimited clinical scenarios to make it. We need to, in a first phase, evaluate what are the clinical scenarios that you have in mind, and after we will decide together to make the clinical scenarios available on the Body Interact. And we can train you on the Body Interact scenario editor, or if you would like, we can also
Dr. Tena, sorry.
I already muted. Thank you. And we also have the possibility to make, for example, to make the scenario together, that it will be something like this. We schedule an online meeting and we will be making together the clinical scenario in the online platform. So the answer is yes, but we need to evaluate previously what are the clinical objectives of the clinical scenario and so on, in order to decide to make it or not. Because in the business model, we do not allow the customers to make it, but we usually allow the customers to make specific clinical scenarios. Not in a very big amount of the clinical scenarios, but according to the needs that you have, comparing with the standard library.
Yeah,
thank you very much for this question.
Okay. Tadi pertanyaannya sudah dijawab, apakah sudah cukup jelas Dr. Andi? Jadi untuk clinical cases kita bisa tambahkan ke dalam Body Interact ini ya. Kemudian memang untuk penambahan clinical casesnya mungkin tadi sudah dijelaskan bahwa ya mungkin nggak langsung serta-merta sekaligus 20 clinical cases at one time, but we can add like a few of clinical cases. Is there any more questions from the floor, or Dr. Andi, do you have any more questions related to the previous question? Okay, so I think the answer is very clear. Is there any more questions from the floor before we get into the simulation from Body Interact? Or can I ask one question to Mr. Severo? Do we need
Yes.
like special gadget to for these applications?
Yeah, you can use it in the web browser. You can use it also installing in your own device. If it is a Windows device, it needs to have a dedicated graphic card. If you would like to install in the Apple devices, it needs to be minimum the iPhone 7 and minimum the iPad needs to be the iPad with minimum of 2 gigabytes of RAM. Regarding the Android devices, the device that we can use it needs to have the augmented reality feature because it is the most actual devices from Android. Regarding the Android, it's not available in this moment, but in a couple of weeks it will be ready to use because we are just finalizing the version for the Android devices.
Thank you very much. Yeah.
And let me just only add something else. Although you can use it in the web browser, it is always depending on the internet. And sometimes in different countries we have problems according to the internet speed. So my suggestion will be always making the offline installation because in this way you can use it with a better user experience because you are not depending on the internet. Although you need to be having always connecting to the internet because in this way all the metrics go to the learning management system of the body tract. For example, if the student is making the clinical scenarios at home, he needs to have the internet connection because in this way all the details of their performance, the performance report, will go to the cloud and the teacher will be seeing the performance report of each student. Just only this detail. But if you would like to use just only with the internet, without having an offline installation, you can also make it.
So we can make it depending on the internet, and also we can make it offline.
Yes. In my suggestion, I'm not sure about how is the internet in Indonesia. If the internet is good, no problem will arise. If the internet is with a poor connection, sometimes my suggestion will be always make the offline installation that you can install in smartphones, in tablets, or also in Windows computers.
Okay, I think it answers my question very well, and I would like to introduce again about what we are having for some doctors who just come in. So, jadi kita membahas tentang body interact para dokter sekalian, yaitu sebuah simulasi digital interaktif yang untuk melatih mahasiswa mengambil keputusan serta untuk melatih soft skill pada pasien yang secara virtual. Jadi body track ini dibawakan oleh PT Java Medica yang mengundang kita untuk pada acara sore hari ini dengan narasumber dari Portugal, Mr. Silvero, dan sekarang kita akan masuk ke dalam simulasi. So now we are going to start the simulation of the body interact with all the faculty staff here. Please, the time is yours.
Thank you very much. Once again, I will be sharing a first case just in order to we will be selecting the case here just in a couple of moments. A case to share how the buttons work. Here you can also see here we can also see the language of the different cases. So you can select the language that you would like to use. We usually use the international English. If you'd like to adjust the units, you can also adjust the units. For example, you can use the glucose in millimole by liter, the degrees Fahrenheit. I'm not sure what are the units that you use for the glucose. Do you use milligrams by deciliter or millimole by liter?
Yes, we use milligram per deciliter.
Okay. This is great. You can also adjust, for example, the sound, the units, the health monitors, and so on. Here, you will be also seeing the cases that we have. If you would like, you can also use the filter. Imagine that I would like to select just only basic cases. So here I just only have basic cases. Imagine that I would like to use, for example, intermediate case regarding, for example, endocrinology. I will go at the back and I can see what are the endocrinology cases regarding the intermediate level. And here we can also see that Victor Jensen, for example, it is a 50 years old patient, 83 kilos, 1 meter 85 centimeters, and a BMI. On the body interact, we have a proportional time. 20 minutes on body interact are more or less 1 hour in real life. So it means that if we are making the request for an EKG, for example, the result will appear in 10 seconds. If we will ask, for example, biochemistry, the result will appear in 45 seconds because we try to keep this proportional time. 20 minutes on body interact are more or less 1 hour in real life. So not always it is the time correspond according to this proportional time, 3 times more faster than in a real life. The scenario will start with a short context briefing by the nurse right now that we will be listening.
Male, in his 50s, was found collapsed in his office. He has regained consciousness, but he keeps complaining that he is not feeling well. This is the first time he has been admitted to the ER, so no medical records can be found.
So this is some information regarding the context. Some information is relevant, some other information is not so relevant. And we will be seeing right now the patient in front of us.
I'm feeling really tired.
And it is right now in the emergency room. And there's not, as in real life, there's not a predefined approach to apply to the patient. If you would like to start making interventions to put a catheter, peripheral catheter, you can make
inserting catheter.
So every decision that you will take, you have the freedom to take this decision. So it is not a pre-designed pathway to solve the clinical case. In my opinion, we should start seeing the visual signs of the patient. For example, we can see the top view of the patient, for example, like right now. We can also see it here, for example, what is the visual signs of the patient, if it is sweating, if it is not sweating, if he's feeling pain. So I see that this patient is sweating. He looks a little bit tired because the eyes are not so open and looks a little bit pallid, but I'm not 100% sure. Let's see the chest movements, if they are normal or abnormal. And let's also check the low members, that it seems that they are okay. We can start making questions to the patient. Although the questions will be the same all over the clinical scenario, the answers will be different according to the patient health conditions. So I will start making questions about how are you feeling right now.
I'm feeling really tired.
Press the question of the button. And he's feeling
I'm
weak.
feeling weak.
Are you feeling any pain? I will press the button.
No, I'm feeling no pain.
Questions regarding medication. What is the medication that he's taking?
I'm taking this Gleeman, Damine once every day, and I'm also taking aspirin, also once every
I will ask also
day.
if he skipped any medication.
A few days ago I forgot to take my daily aspirin, so, the day after, I had one in the morning and another at night.
I can also make other questions that I already know that are not a priority. For example, how much do you walk each day?
I haven't been walking much,
Because
no.
you can also have the possibility to make questions that are non-a-priority for this specific clinical scenario. I don't know if you have any question until this moment, or if I can go forward with the simulation. I believe that I can go forward with simulation. Let's start making the physical exam, for example. With the ABCD approach, let me check, for example, the airway observation. I will click and I will be seeing the image of the virtual patient.
I'm feeling really tired.
And I can see that the airway is open, not obstructed and safe, and no upper airway abdominal noises. Sorry. We can also see in the B the pulmonary auscultation, that I can drag the stethoscope to different positions, and I can listen different sound. If I would like, I can also sit the patient on the bed, and I can also auscultate at the back. I can make, for example, chest percussion, that these are the predefined hotspots that I will be pressing, and I will be receiving sound as an output. And you can also make, for example, the chest palpation, that there are these predefined hotspots that we can also press, and you can also receive the feedback based on text. Here we can also make, for example, in the C, you can make the capillary fill time, for example, that you request, and you also receive the output of 3 seconds, for example, in this case. You can also make the heart
I'm feeling really tired.
Pulse palpation, for example. I will press these predefined hotspots, and I will be getting the different hotspots that they will be seeing. We can also see the pupillate reflex, for example, that I will change the cameras and I will drive to the light to the pupils in order to see if the pupils are reacting to the light or not. If you see, right now the patient is not conscious because it's not blinking the eyes. So it means that we have been losing time making some exams, and he did not the patient health conditions were not better. I can start monitoring the patient. I can see that the temperature, it is okay. And we can also see the vital monitors, for example, the blood pressure. Here we can also see that blood pressure are a little bit high, but I believe that it's not the main problem right now. We can check the pulse, the breath rate, oxygen saturation. If you would like, you can also see here a 2-lead ECG, but if you would like, you can also request a 12-lead ECG.
Just a moment, here is the
requesting the 12-lead
ECG.
ECG. I will be seeing right now the 12-lead ECG, and I can also see that the patient is in sinus rhythm. We can make exams that I would like to make. For example, I will order a biochemistry.
A full biochemistry has been requested to the lab. X-ray, we only need to bring the machine here.
The exams. If you see, the X-ray already arrives, and if you would like, we can also call the report that tell us that the lungs are clear, the heart is normal in size, and the mediastinum is within normal limits. We should wait a little bit more time for the biochemistry results, and every parameter that is outside the reference interval is signalized with red, and we can see that the blood glucose is lower than the reference interval. If you check it in the glucometer, it is also available. And to show you that we can also make mistakes, I will give to this patient some insulin intravenous bolus, 8 units of insulin. I believe that we will decrease a lot the blood sugar in the end. We will probably face some problems to the patient. But it is just only to show you how the patient health conditions can change. If you see the patient COVID, and we need to start making right now the advanced life support.
Applying
So I will
chest
start
compressions.
making the life compressions. I will also
Proceeding to
intubate the
intubate.
patient with a ventilator.
Done. Turning on
And I
ventilator.
will also give some adrenaline as I'm making the advanced life support. So if we make wrong decisions, the patient health condition will change. Right now, I decided to make the life compressions. I decided to intubate the patient, and I'm trying to see if the patient will recover or not. I believe that now the patient recovered, but we have more problems than previously because the blood pressure is very low, and I believe that right now I will give some crystalloid infusion, 1 liter 500 milliliters. I believe that we can also need to keep the patient on the ventilator because the oxygen saturation is low. I will also give some fluids, some 30% glucose, 80 milliliters, in order to help to raise a little bit the blood sugar. I believe that we can also change the patient position, raising 45 degrees the headboard, because with this strategy it will be also helping to increase the oxygen saturation. So if we see the blood sugar is inside the reference interval, I will order again the lab test with the biochemistry.
A full biochemistry has been requested to the
The
lab.
blood pressure is improving. The oxygen saturation is also improving. And we can also see here the previous biochemistry was this one on the right side, and we can also see how we improved the patient, because here on the left side it is the actual biochemistry. So previous the blood glucose was very low, and right now is inside the reference interval. So the oxygen saturation is keeping improving. So I will have the strategy to put a high flow mask to the patient
1
and
minute.
to quit the ventilator.
High flow mask in
The
place.
patient is still not conscious. If I would like to ask, for example, the head CT, I can order
Head
the
CT scan underway.
although I already know that does not make any sense in this specific clinical scenario to have this exam. But as I told you in the beginning of our meeting, I have the freedom to ask the exams that I would like to see. In the meantime, if you see, the oxygen saturation now is better, and I believe that we will be receiving the HCT here. It is also with the report. We can also see in detail. If you'd like, we can also pause, make zoom, and go forward to see the
I'm feeling
details.
really tired.
In the meantime, the patient waked up, is not conscious, and I will ask him how is he feeling right now.
I'm feeling better now.
Feeling better now. So as I told you before, the answers from the patient will be also changing according to the patient health condition. So in the beginning of the scenario, the patient was feeling weak, and right now the patient is feeling better. The scenario can end in three different ways. Or we receive this message, congratulations that we met the guidelines, or we also receive a message that the time was over, or the patient was so unstable that we are invited to go to debriefing, or we just only decide, let's go to debriefing, and we can select go to the debriefing. Right now we receive the mention that I would like to receive every day, that is that my practice meet the guidelines, and now we can also have, without stress, to answer to these questions regarding the diagnosis. Regarding the diagnosis, I think it was an hypoglycemia, but I can put it was an ischemic stroke, but let's go forward with an hypoglycemia, and the answer was corrected. If you are dealing with the patient regarding the possibility to make the scenarios when they are at home, the students are at home, you can have the decisions to share the the decisions to share the debriefing tools with them or not. Right now we will explore together the debriefing tools that gives you the information regarding how have we been performing during the clinical scenario. So I don't know if you have any question until this moment, or if I should move forward to the debriefing tools to explore together.
Para dokter sekalian dan para staf pengajar, apakah ada pertanyaan atau kita lanjut saja, Dok? Kita lanjut saja dulu ya. Kalau misalnya ada pertanyaan, mungkin bisa juga diketikkan di kolom chat. I think we can just proceed to the debriefing. If there is any questions, we can type it on the chat.
Okay, thank you very much. So I will explore right now the debriefing. So we have the possibility to see the whole timeline of the debriefing. If you see in the superior part, we can also see the vital parameters. What have we been doing? What were the exams that we have been seeing? What were the results? What was the impact of our decisions in the untreated conditions of the patient? Let me check here when I gave the insulin and when the patient have the cardiac arrest. So if you see, right now the vital monitors have the red color, and we can understand why. Because we gave the 8 units of insulin. This is the explanation about what was the impact to enter in a cardiac arrest. After the cardiac arrest, we can see that the patient is still in severe hypoxia and hypotension, and we can see that after we stabilize the blood pressure parameters, and we can also just only have the severe hypoxia, and at the end we can see that no untreated conditions to treat. So here you can see what was corrected as priority, what was made that was not a priority. For example, let me show you the global score. For example, regarding the physical examination, diagnostic activity and treatment, I can see that regarding the disability, I should also request the Glasgow Coma Scale. In the Glasgow Coma Scale, it gives you also the possibility that is a first priority exam that I should request, but unfortunately I did not request it. For the circulation, for example, I requested the urinary output, and we can also see here that output was non a priority. you can also see that is non-priority urinary output. You can see the same approach, for example, the treatment, the medication that we gave as a first priority, but we can also give as a second priority, and so on. And we can also see here that you can see the competencies that we have been working during all the clinical scenario, the basic wear management, the capillary fill time, oximetry, interpretation, and so on. And if you would like, you can also see what were the guidelines, the scientific reference that this scenario was based. You, as a teacher, you will also have the possibility to add learning resources. So here you can also add some PowerPoint documents, some movies, everything that you would like to add, you can also see it in the folder. So it was a very quick overview about the debriefing tools. I believe that now you have some questions, or if you would like to explore together different clinical scenarios in each area that you would like to explore, we will be 100% free to explore the clinical scenario together.
Oke, baik. Para dokter sekalian dan staf Fakultas Kedokteran Atma Jaya, apakah ada yang mau ditanyakan atau ada yang ingin melihat kasus-kasus skenario klinik lainnya? Atau mungkin dari PT Java Medica ada yang mau ditambahkan? Okay, ya. Baik, terima kasih Pak Yasir. I think there are some questions coming in from the chat. Mr. Sabaro.
Yes,
Yeah.
I'm seeing right now, thank you very much, from Professor Andy Stewan. We'll do regularly at scenarios to body interact. Yes, we are always developing new clinical scenarios during month by month, and we are also putting them available in the standard library of the scenarios. If we can suppose the case in the middle to discuss with students, yes, it is true. In the upper part of the user interface, you have the timer running, but you also have the possibility to use the pause button. I will make it right now in order to show you that, for example, here I will try again.
Mail.
We can be exploring the clinical case here with the student.
I'm feeling really
every
tired.
time that we would like, the time is running 90 minutes, for example, and now I post and it dips in the 90 minutes 46 seconds, and we can see the whole timeline, the things that we have been doing until right now. And if we can, if you want, we can also pause here right now. We can pause in this time. We can change the point of views during the clinical scenarios, and we can also move forward with the discussion of the clinical case. Regarding the another question, I will not share the screen right now. Regarding the another question from Professor Melly, are the scenarios categorized based on subjects such as dermatology or pediatric or ENT? Yes, they are in different content package. I will show you right now here in the screen the different content package that we have, because each clinical scenarios have different content package. Let me also see it here. For example, we have Fundamentals of Medicine. This content package have inside these 10 clinical scenarios. The Fundamentals of Medicine 2, for example, have these 10 clinical scenarios inside. If you would like, for example, we also have the cardiovascular system content package, the respiratory system, nervous system, general internal medicine, the trauma, pediatrics, pregnancy, general medical, paramedics, ambulance transportation, future healthcare professionals, and so on. So we have different content package, and each content package also have inside each 10 clinical scenarios to be available to explore. Regarding the question from Professor Rialino, the body interact anesthesia cases, unfortunately in this moment we do not have any anesthesia cases available, but we are working on the ventilator algorithm, and I believe that during this first semester of 2021 we will be having the possibility to launch the first anesthesia clinical scenarios, because right now the ventilator that we have, it is just only connecting the ventilator, and it is a smart ventilator. The dosage and so on, it is immediated, defined by the system. But we are working on a ventilator that, as in a real life, you need to parameterize the ventilator according to the needs. That's why until this moment we do not have any anesthesia clinical scenarios, but in this first semester we will have the first clinical scenarios in the anesthesia field. I don't know if I was clear answering the 4 questions that we received.
I think it is very very clear. Jadi tadi kita bisa lihat ya dok bahwa ada so we can see that there are some what do we call it, like a number of scenarios that we can access to. Jadi kita akan and we can also pause in the middle to discuss with the students. And yes, the scenarios some are based on the body system. But however, for the anesthesia-related cases, the body interact is developing for it.
Yes, unfortunately, in this moment, we do not have specific clinical scenarios for anesthesia, but soon we will have it also.
Ya, saya rasa jawaban tadi cukup jelas. Baik, apakah ada pertanyaan lagi dari floor? And regarding to the previous question, how are we going to add the scenario? Because like there is already like bank of scenarios in the system. How are we going to add the scenarios and also the body, the review of the body system?
Yes, regarding the clinical scenarios, you will be invited to select the content package that you would like to be using during the coming 12 months. Sorry. And once you select the content package that you would like to use during the 12 months, you can use it these scenarios. After the 12 months, you will have the possibility to change the content package by another content package that you would like to know. But imagine, for example, from Professor Yelino, he needs to have the anesthesia clinical scenarios. So probably in May or June, we will be inviting you to quit a content package that you select previously, and after we will be inviting you to select the content package that you would like to use with the anesthesia cases. So the role is to select the same content package to use it all over the 12 months, but obviously that in some specific conditions we open the exception to bring to the library different clinical scenarios that you would like to use during the year. So you can have the possibility to see also and to increase the number of the scenarios according with some scenarios and put new scenarios to the system. So in this specific case of the anesthesia field, it is this need, because if you will be licensing the system right now, we will be not having the possibility to give you the anesthesia clinical scenarios. But in the middle of the licensing period, we can give it for you if you quit some other content package that you have been using.
Oke, jadi kalau tadi kesimpulannya adalah kalau misalnya memang ada paket baru seperti misalnya tadi ya anestesi sudah berhasil dikembangkan pertengahan Juli, maka bisa kita mengaksesnya. Tapi kalau enggak, kita udah kayak membeli satu paket itu untuk setahun kurang lebih gitu ya Pak Yasir ya. Okay, thank you. Terima kasih Pak Yasir. Thank you, Mr. Zaverio. Is there anything more that you want to add up or any questions from the floor?
It is in your hand.
Jadi bagaimana para dokter sekalian, apakah kita masih bisa melihat satu senario lagi nggak ya Pak Yasir? Okay, okay. How about let's try another scenario. Do you have any scenario probably from other specialty field?
Yes. Would you like to make a pediatric clinical scenario, for example?
Sure.
Okay.
Yes.
Okay. I will be performing right now.
Pak Yasir, berarti ini nggak bisa dimodifikasi ya skenario-nya ya, sudah jadi aja gitu ya skenario-nya. Sudah ada pilihan gitu ya. Oh ya, so the questions that is listed on the dialogue, it is already typed there. So what if we want to type more questions for the simulation cases?
Yes, you also have the possibility to edit, to customize the existing clinical scenario, that you can also add questions and answers according to the criteria. Because in the licensing model, we will also give you the possibility to customize the existing clinical scenarios.
So we can customize the existing clinical cases.
Yes, if you would like, you can make it.
Thank you. Jadi bisa Pak Yasir ya, itu kita modifikasi kayak katanya itu tadi. Ya.
So we can see right now this Roderick, for example. We can start listening the briefing from the nurse.
Roderick is a 2.5-year-old boy with no known history of any previous disease. He was brought to the emergency department because he was found extremely sleepy during the afternoon, and eventually he became unresponsive. He had been staying with his grandmother at her house since morning. He had been playing around the house during the morning.
We have here the information. I believe that once he has 2.5 years, we can probably address some questions to his mother or his father. Let's see who bring him to the hospital. So it is his mother. So we can see the visual signs of the patient, so it is not conscious, we can see in detail. I believe that you would like to make some questions to the mother. Do you agree with me? Let's ask, when did you notice he was not well?
It was just a while ago. I could not find him, or hear him play, so I went to look for him, and found him lying down on the floor in my bedroom.
Okay. Did you notice anything else about him? Did he cough, vomit, or cry?
No, during the morning he was playful and active as usual. Then he had lunch, but he didn't eat very well.
When you found him, was he not reacting as he is now?
No, at that time he was asleep, but he woke when I called him. He tried to sit up, but was drowsy and went to sleep again. He would not talk to me.
Okay, what are your sleeping pills? Do you know the name and doses?
It's lorazepam 2.5 milligrams.
Okay. Does he take any medication?
No, not that I'm aware of. I already called his mom and she's coming. Maybe she knows.
Do you think he may take of medications at your house?
I don't know if he did.
Do you have any medications around?
I have sleeping pills in a small box in my bedroom, but I was so nervous I didn't even check.
So let's check the airway. The airway, it is also clear. Let's check the pulmonary auscultation. If you see right now, it is a little bit red in the face. Let's see the pulmonary auscultation. let's see the extremities to touch. The extremities are cold to touch. Let's monitor. Temperature is okay. Here we can see that the pulse is fast. Let's see also the pupillate reflex. The pupil is reacting. Sorry. So we can probably make also the Glasgow Coma Scale. Severe impairment of consciousness. And let's ask here regarding the arterial blood gas.
Arterial blood gas is being for a full biochemistry has been
and complete
test
blood
ordered.
count. The arterial blood gas we already have in front of us. These are the items that are outside the reference interval, that are signalized with red. I will always also make the venous blood gas.
Test ordered.
And the urinalysis, I believe that also makes sense. Venous blood gas, we also have the result here. Complete blood count, everything good. Let me add here the urinalysis.
Test ordered.
If you would like to recheck the exams, we can also see it here in this folder. And if you see there in the urinalysis, that is idiotic intoxicants positive for benzodiazepines. So we can probably need to go forward with the manual ventilation.
1 minute. High flow mask in place.
Let me also make regarding here the fluids. Let's make the sodium chloride. In the meantime, let me put the catheter.
Inserting catheter.
They are putting the catheter right now. And let's go to the sodium intravenous bolus 20 milliliter. Let's make also the antidotes. Let's make 10 micrograms. And also to make the Gedel tube. Now if you see, he is already conscious because he already opened the eyes. And I believe that we can also call
requesting assistance from an ICU physician.
The blood pressure is very, very low. Pediatric ISF care is here. Recommends non-invasive ventilation.
Performing intervention.
So I'm putting the manual ventilation. And right now, let's see. And we can go to the debriefing. and we can see that was the toxicity. And here we can also see that I should also check the pulse palpation in the capillary fill time. During output, it's not mandatory to make it. Regarding the disability, I should also request the blood glucose. Although I made the biochemistry, I should also request the blood glucose with a glucometer. Regarding diagnostic activity, I made the first priority questions. I did not make any second priority questions. And regarding the tests, I can also make the transthoracic echocardiogram and the 12-lead ECG, but it is not mandatory because they are second priority. And these are the competencies that we have been working with this specific clinical scenario. Regarding the guidelines, we can also see what were the guidelines that we followed on this specific clinical scenario.
Okay. Yeah. Thank you for the second case. And we can see like how the debriefing, what to say, how the debriefing can give a more educating features in the body interact for the discussion between the lecturer and also the students. Jadi apakah mungkin dari para dokter sekalian, para staf pengajar, apakah ada yang ingin ditanyakan? Saya rasa, I think the explanation that Mr. Silverio has given us a very brief yet thorough and clear explanation about the body interact application. And I think for the details of how to use it and all what we need in using it in our daily practice for education, I think we can follow up this with PT Java Medica, which is sebagai yang ini ya, for as the distributor in our country. Baik. Well, thank you very much for all the participants who has joined us. If there are no further questions, or is there is no more that you want to add up, both from Mr. Silverio and also from PT Java Medica, I think we can end the session for today. Thank you very much for your precious time and precious knowledge about this application. Mungkin dari PT Java Medica, apakah ada yang ingin disampaikan? Oke, ya. Oke, baik. Kalau begitu, Mr. Silverio, anything else you want to add up?
No, just only thank you very much for this opportunity. If you would like, we can also share with you some trial accounts that you can explore according to the cases that you would like to explore. And with Yazir, you are in very good hands to work with him.
Thank you very much, Mr. Silverio. Terima kasih PT Java Medica. Dr. Rika, ada yang ingin disampaikan, Dr. Rika?
tidak, saya rasa tidak ada yang saya ingin sampaikan. Paling nanti minta Pak Yasir untuk lebih lanjut pembuatan penawaran dan sebagainya. Bagaimana kami bisa melanjutkan untuk melihat lebih dalam mengenai aplikasi ini. Thank you for listening.
Baiklah.
Dengan Dr. Nelson saja dulu, Pak Yasir. Terima kasih.
Oke, thank you very much. Ya, terima kasih Dr. Rika. Thank you very much, Mr. Silverio. We have our vice dean here and all the faculty and some of the faculty staffs. I'm very sure that it is a very, very beneficial beneficial development of IT for us as educators, and have a healthy and safe days and year 2021. Happy New Year to all of us. Thank you very much, and have a pleasant day. Have a pleasant evening for all of us in Jakarta, Indonesia. Good morning in Portugal now. Okay.
Thank you very much. It was a pleasure for me.
Ya, kalau begitu saya sudahi acara hari ini. Saya tutup acara hari ini. Terima kasih atas perhatiannya dokter-dokter semua. Selamat sore menjelang malam. Bye-bye.
Thank you very much.
Thank you very much.